Welcome back to another episode of Sports Medicine on Tap. My name is Brandon O'Lyon. I'm sitting here at Neck of the Woods Brewing Company enjoying a nice cold beverage with my good friend Dr. Frey. Dr. Frey, good evening.
How you doing, man?
I'm doing well. It feels like we haven't been here in a little bit.
It does.
But we're back. We're here.
Yeah.
Last time we were here, we talked to our good friend Scott Armistead from the FC Cincinnati.
Heck yeah. Congratulations.
On a big, exciting win. Penalty kicks in soccer, I feel like that's one of the most exciting finishes in a sport.
That's how it goes, for sure.
They get pretty exciting in that stuff, so hopefully they have a good playoff run and they keep going.
I was unaware the playoff format changed. I don't think they did that last year, where it looks like it's 2 out of 3 this year. And so they got to win. Union got to win. Exciting. I think Union plays again tomorrow. We record on Tuesday night, right? So by the time this airs, by the time we post it, they will have already played that game.
Correct.
And then FC Charlotte. Oh man, I'm sorry. Yeah,
Tyler.
Yeah. Playing game, lost to New York, but hey, good season. They're still in a club that's relatively new. Yeah,
right.
Well done.
Have a lot of bright future. So
exactly.
So now we're here. And, we're going to talk a little bit of Philly sports.
Over my tiny beer.
Over this little baby beer. But no, it's packs a punch, though.
Right.
Oh, man, what's it called? Oh, the Meet Your Maker, yes.
Right. This is the delicious one, right? So we had Frank on maybe 2 episodes ago, and actually that was like the majority of our show, right? Talking about that beer.
Yeah.
And we talked about how we went back and we tried one of the spectacular beers right out of the barrel, and it was this, and for those of you who are viewing on YouTube as opposed to listening onto the podcast, you can see this tiny little beer, but it's a strong one, and you have the M Night.
The M Night, yes, the mango sour.
Oh, it's good,
so good, and way better with a little bit of carbonation in there now too, as well, from when we tasted it before, pre-carbonation, which is. What a treat.
Nailed it,
of course.
Yeah. And then we have a good friend, Dr. Jennings.
Yeah, we got
phone.
Dr. Jennings back on. Dr. Jennings, how you doing?
I'm doing good, thanks. Wish I was there with you guys enjoying the beverages. I'm by myself over here.
Yeah.
Still enjoying the beverage, but not neck of the woods, unfortunately.
What's in your hand, my friend?
Oh, I got a Guinness in my hand.
Right.
And
if you're alone, there's a whole big ton of them. No, I'm joking. Just drinking to oblivion.
Yeah, exactly. One of these days, next time we'll do this in person, and that way it's not just a picture of my face on YouTube or what have you. But next time we'll do it in person. Obviously, we'll talk about the reason you guys asked me to come, but just timing wise, I couldn't make it work. But I'm here to hang and have fun.
Yeah, absolutely. And we appreciate you making the effort and the time. That's also a pretty big thing. We're all very busy. We all got things going on. At least you're nice enough to give us your time and jump on a phone call.
Thanks, man.
And we can't be more appreciative of that. But
anytime.
We bring in the big guns and the experts because we have a pretty big, interesting injury to talk about. Again, Philly sports fans are riding the Eagles the wave pretty heavy.
Oh boy, yeah.
The Phillies let us down, but we're back in full swing of football season.
That was a rough one, man.
Oh man, we haven't done a show since the Phillies got knocked out of the playoffs.
It just occurred to me we have not done a show since they got knocked out.
So it's hard to catch up on everything that we've missed in the last couple of weeks or whatever the case is. But, the Eagles are doing great. They had a big game against Dallas. And ironically, we're here talking about Dallas Goedert, our tight end, who unfortunately doesn't do well this time of year, this middle third or the middle of the season. Last year he had a wicked shoulder injury, I think, if I remember correctly. And now this week he kind of went down with what's being reported as a forearm fracture.
Right.
And was reported is going to be getting surgery or has already gotten surgery. So now we can pick this apart and kind of see what we're looking at.
It's a big deal, right? This team is it's 7-1, 8-1. 8-1 coming into their bye, and looks like potentially the best team in football. And like he's a key part of that. So this has implications for sure.
So Dr. Jennings, we kind of briefly talked about a little bit pre-show. We watched. You said that you watched the injury live, and just kind of take us through some of your thoughts on what you saw when you saw it happen, and kind of what you think about it so far.
Yeah, I mean, watching it go down live, and then of course the excruciating slow motion over and over replays, and I have to say, I mean, Goddard straight arming him. The guy's taking any form of leverage he can get to bring Goedert down.
Right.
There's a lot of people crying foul, like right off the bat, saying he's like trying to break his arm and all this kind of stuff. I don't. I mean, it's football. Like, you know what I mean? I see a lot of weird stuff out of the Cowboys all the time. This didn't feel that way to me. I think that it was aggressive, but basically, Goddard straight arming him after making this incredible catch.
Right.
And, when the guy's got his arm in your face, he's got to bring him down with something. He's not going to, he's not going to be able to wrap him up down low.
Yeah.
And so he grabs his arm and takes him to the ground with his arm. And then, you see him get up holding his arm. And you guys are in this position way more than you're sitting on the sideline.
Right.
And a guy's coming over, like, holding his arm like that.
Yeah.
Yeah.
That could be it can be a stinger, AC joint, shoulder dislocation, humerus fracture, elbow injury, wrist injury. And then next thing you know, it's, we didn't actually, I didn't get that much more information really since then. I was telling you guys, I'm friendly with the Eagles team, the hand surgeon for the Eagles, but I didn't personally reach out to him to see or anything like that. But there's a lot of speculation, some kind of about tests being ordered or surgery being done, like you were saying.
Right. Yeah,
no. Allegedly a forearm fracture. That's all that seems to be coming out that I've heard. Unless you guys have heard differently than me.
No, I think you hit it right on the head there. And I mean, I've been scouring Twitter and all social media to see if I can get any extra information. I was looking up Dallas Goedert injury, surgery, anything like that, but it just all the headlines and everything is just a forearm fracture, and he's going to get surgery.
Yeah.
It's hard to make heads or tails of what because for forearm fractures they talked about an MRI being ordered and all this stuff. I'm not really sure. We were joking earlier, but people show up as MRI follow up on our schedules on a daily basis that have gotten an ultrasound, a CT scan, whatever the case may be.
Yeah.
And so
just how they get
knows
scheduled.
How this information being conveyed to the public. A CT scan for a forearm fracture near the elbow, especially, completely reasonable.
Right.
MRI, I don't know. I guess when you have unlimited resources, want to take a look at the elbow ligaments, or there are other kind of forearm injuries where it kind of travels down the connective tissue between the two bones in the arm.
Right.
I'm not 100% sure that changes the way we treat these, but I mean, again, in the age of an MRI machine being in the link or whatever, it's conceivable to just get it.
Yeah.
To make sure you're addressing everything, but wouldn't really be part of my normal algorithm for this, let's just say.
So I was going to go right down that exact road, right? Like typically, it's being reported as a forearm fracture, right? Like typically X-rays are enough to make that diagnosis. Right. But and he got those in the locker room, right? Like they were in the training room, they have the X-ray machine. And then so immediately he's off. They send him off. He goes to the hospital, whatnot, and they start reporting. All right, he's going to need an MRI. And this injury was originally reported as well, I shouldn't say originally. Some outlets were reporting a wrist fracture. Some outlets were reporting a forearm fracture, which would at least trying to piece the puzzle together, connect the dots here, would make you think not up by the elbow like you were saying, where a CT is probably a little more warranted, but probably down closer to the wrist. And so if it is down a little bit closer to the wrist, and we don't know if it's a one bone or both bones, and if it's one bone, which of the two bones it is that got fractured in the forearm. But John, can you tell us first a little bit about the anatomy of the forearm, kind of bones and whatnot in there? And then what about the possibility of this other injury that I think you were just alluding to, this something called an Essex Lopresti injury? What would that be, and is there any role for an MRI in determining that?
Yeah, that's a lot, but
I know.
Loaded question. Here you go.
Yeah, exactly.
The podcast is what, 3 hours or 4 hours? I can't remember.
Exactly.
Yeah, I mean, anatomy, we don't know. When they say forearm, we, like you were talking about, that technically can stretch anywhere from the radius and the ulna make up the forearm. There are two bones that make up the forearm.
Right.
So when they mention a fracture, it's implicit that there is one of those two or both broken. Right. And that starts up at your elbow, goes all the way down to your wrist, just like you were saying, Steve.
Right.
And so, there are obviously all of the muscles and tendons and everything.
And that's
your fingers,
I think over detailed
straighten your
for
wrist.
getting into that. Yeah.
And so, depending on what level that is, will kind of gauge your surgical approach. It'll gauge your recovery, your rehab, all that kind of stuff. And, maybe who knows where these things are or whatever, but as you move further down the arm, your recovery and all that stuff, expectations, which I'm sure everyone's dying to get into about that.
Right. On the horizon, we're getting there.
Yeah. So it's a pretty meticulous system that helps our arm in particular rotate so that you can turn palm up and palm down.
Pronation,
and that requires, basically perfect anatomy and the link between those two bones being intact. And so the Essex Lopresti is just a big fancy name to say, basically not just a broken bone, but that ligament connecting the two bones has been disrupted. And what that turns into is basically an injury that's down at the wrist as well. But, we usually don't MRI that because we kind of, that can be sort of figured out during surgery, and usually fixing the bone kind of fixes that problem. It doesn't solve that problem, there are other things we can do to fit, whether it's soft tissue or bone, pinning the bones together or whatever it is. There are other things we can do to restore that, but that's usually more of like a game time thing. And I'm not sure you would really know any more about what you would do based on the MRI.
Right. Yeah, that was the only thing, because just like you're commenting, I saw, you had the fracture, they're going to do an MRI tomorrow, get a little more information. And I was like, what? That's not really standard. And that was the only thing that came to mind. And, not regularly treating these as, do they MRI nowadays to look for Essex Lopresti, and there's the Galeazzi and Monteja fractures, or other kinds of fracture dislocations and variants and whatnot. I have to presume that's not what he had here, but that was the only one that entered my mind as a possibility. I couldn't figure out anything else that they would be looking for possibly with an MRI, and I think it's. I
think in all likelihood he got a CT scan, and it was just reported as an MRI.
Yeah. And I didn't even go down that route, but you're right.
Because again, we're really filling in a lot of blanks here without even knowing what the actual injury was itself. But
disclaimer time.
If it is forearm fracture or anything related, I think a CT scan is reasonable.
Right.
Especially if it involves either the wrist or the elbow.
Right.
Mid shaft forearm, that wouldn't make sense really either, honestly. But who knows?
Right.
They're playing their cards pretty tight to their chest with this one, and I think time will tell what ended up going down here.
And and we say it all the time. We don't truly have access to Dallas Goedert's medical chart and medical records.
Right.
We don't know what the actual true injury was, and thus we're not revealing any specific information about him. We're just taking what information has been public and just talking about it and what that generally means for injuries in athletes and whatnot. Pretty bad injury. So what are your thoughts on the fact that when I think of these? So I have another two-part question. Sorry. One, when I was watching the replay of the injury, there's some blood there. And the first thought in my head was like, ooh, is this an open fracture? Or is this actually just a little bit of,
turf burn or something?
It's turf burn, and he's a football player, and there's a little bit of blood, but you could see like on a gauze pad or something or other, a little bit of blood, number one. And number two, it seemed almost like he was just kind of walking off. And my impression of a especially if it's a both bone forearm fracture in an adult, it's floppy, man.
Right.
It's pretty rough to see. What are your thoughts? And they just kind of like let him walk off. I was a little surprised by that, like it's kind of dangling there. What are your thoughts? One, is there a possibility this was open? And two, do you think there's any indication of whether this was a just one bone, a single bone fracture, or versus a both bone forearm fracture for Dallas Goedert?
Yeah, I kind of missed a little bit of the second part. I think I caught where you're going with that, but
sure.
Open fracture, I highly doubt.
Yeah.
For a couple of reasons. One, they wouldn't be getting an MRI to see how things are looking in there.
Right.
You know what I mean? Like,
they're going to the OR.
For us, the literature on open fractures and to fill in the detail there, what Steve's talking about is any break, technically speaking, where the bone causes an open wound in the skin.
Mm-hmm. Yeah.
So, as gruesome as it is to think about, part of that jagged edge of the bone actually cuts the skin from the inside out.
Yep. Pokes on.
We think of that as an open fracture. Some people call it a compound fracture.
All the term.
There's a lot of names for that, but and then there's all these classifications. But in the arm, we have kind of moved away from like rushing people for small open wounds to the OR immediately, thinking the literature supports that they can probably be starting antibiotics and wait.
Yeah.
But in a guy who's worth what Dallas Goedert is worth,
right?
Yeah.
And after seeing some of the lawsuits against orthopedic surgeons in the past year,
and
for $1 trillion, I can't imagine that if that was an open fracture, he wouldn't have been in surgery within 2 hours of the game.
Right.
And so that's number one. Number two is, by its very nature, an open fracture, to even be an open fracture, there has to be a significant amount of fracture displacement.
Yeah.
And, usually the arm looks bad, real bad.
That's what I'm saying.
And so I did not see that.
Yeah.
An
extra elbow.
Yeah. We talk all the time about these like little, the ulna, the bone on the pinky side of your forearm, does sit literally right below the skin, so that doesn't take much.
Yeah.
But I don't know. I have a hard time believing that would be the case for this by its nature. And in terms of him, like, being surprised to see him walking off, I'm not. I mean, I know you've been watching a lot of MLS, it sounds like, lately. But these are football players, so there's no crying allowed for spraining your ankle or having someone step on your shoe.
Right.
But, it's like we were talking about before. I mean, you guys have been on the sidelines a lot more than I have. Yeah. And, you see people holding that arm in the same way, amazingly, for an AC dislocation all the way up at your shoulder to a wrist fracture.
Right.
Literally anywhere. And that's why it's really tough to, like, kind of nail down a diagnosis just by his demeanor or the way he was carrying himself walking off the field.
Right. I'll tell you, Brandon nailed it. Like I had stepped away. I was watching some of the game, and I had stepped away for a minute, and we were actually talking about another potential injury that maybe we cover next week or the week after that. And all of a sudden, Brandon's like, I think Dallas Goedert just broke his forearm. That's where we're going. Like immediately he saw it and he knew exactly what was going on. I got to give him a lot of credit. All right, well, that's where we want to go.
It was a good educated guess, just by the nature of the injury. And then when I saw him walking off holding his elbow, and like you said, Dr. Jennings, like he was holding his elbow, so I was like, it doesn't look dislocated. He looks like in place, but he's just walking off kind of weird. And then they showed the replay in slow motion. I'm like, oh, he just had a linebacker, literally just all his weight right on the forearm. And like in a weird angle, it's kind of outstretched a little bit. And I was like, that just can't be good, like I don't have a good feeling about this. And he walked off, and then they're like, oh, he's a wrist injury. And I think the sideline reporter said wrist injury. I was like, oh, that's could be beneficial. And then he's out for the game. I'm like, oh, no, it's got to be fractured. It's got to be.
Yeah. I mean, just watching it, there's two parts of that. One is him going down with basically the linebacker's got his arms wrapped around his forearm or elbow area and forcefully down.
Yeah.
And then the part that orthopedic surgeons really don't like to see is the twist, the roll of
the twist.
Because, we talk about a lot of like biomechanics and stuff.
Yeah.
Our bones tolerate a really, really high amount of stress of we call axial loading. Like if you jumped off your roof and landed on your feet, you put load through those bones, and amazingly, as long as you don't like twist your ankle on the way down or something, you can like tolerate a pretty good amount of that.
Right.
Bending, we tolerate a little more, but a little less, but not, it's worse. Bending of the bones is not really well tolerated. Twisting, or we say torsion, our bones are really not good at tolerating that very well. And that is definitely like, when you see that turnover, that is not good.
Right, exactly. Now we know it's a forearm fracture. We don't know if it's a both bone forearm fracture. We don't know if it's what we call a nightstick fracture, kind of your ulnar fracture, or if it's a radius fracture. Presumably, it's not really close to the wrist. Presumably, it's not really close to the elbow. Somewhere in the middle there. What are the different treatment options? Like, is there a role for potentially, because they said he's getting surgery, but is there any role for potentially casting? And then if you go down the surgical route, what is the preferred surgery?
It's very, very nuanced. I think that's really, really tough to answer with the information that we have.
A little bit of information, right.
Because, sure. I mean, like radial head, radial neck fractures, which are very high up in the forearm.
Yeah, we're going to exclude those as possibilities.
We manage those routinely without surgery.
Yeah.
Certain types of wrist injuries. A shaft injury is what we describe as a fracture of necessity. So outside of extreme age groups or, somebody medically unfit to have surgery, that has to be fixed, unfortunately. Yeah. And that's usually done just by, getting the anatomy back where it should be and putting a plate and screws on each bone.
Right.
I'm assuming is what he's got, although, I don't.
Yeah. I'm assuming as well. I'm gonna start to get in the weeds a little bit. We may lose the average listener here for a second here, but maybe the ortho resident pays attention a tiny bit. So is there an advantage to plates over rods in this one? If so, what kind of plates, and typically what kind of approach are you gonna use to get down to that fracture to try to put it back together and try to fix it?
Rods are common in kids. We really have gotten away from them in adults.
Yeah.
I'm not aware of anyone rodding adult forearm fractures. There's been some variations on the rod for like distal ulna stuff.
Right.
But for the most part, we're using plates, and in a mid shaft, we try to use 3.5 millimeter. It's getting a little bit into the woods on it, but in mid shaft we can usually get a pretty reasonable. Yeah, exactly. Dynamic compression. Yeah, so we use locking plates too. Pretty exclusively. So we don't use little guys. We try to put a good sturdy plate on there.
Yeah.
And at least get. My goal is to get 3 screws before and 3 screws after the fracture in each bone.
6 cortices.
6 cortices, yeah. So
with non-locking.
And there's more to that discussion with an NFL athlete. You might want to go a little bit longer just to keep the bone protected. You might want to think about where the plate stops. But, if it's getting into the radial metaphysis or something like that, just so that he's not at an increased risk for fracture in the future, where the plate ends, because the plate is stiff.
Yeah.
The ones I use for the most part are stainless steel. They make titanium versions of that as well. And so that transition from where the plate and bone are, where the bone's stiff, to where it's back to your normal bone can be a relative weak point if you got tackled or twisted or whatever again in the future.
Stress rising.
But yeah, approach wise, we approach them each. We try to approach them each through separate incisions. I've recently actually had a really bad forearm fracture where I sort of was looking at the ulna through the approach to the radius because it was so displaced. But the reason for that is to try to prevent a theoretic risk where if you try to fix both of them through the same incision, your body can start to form bone that connects between the two. We call that heterotopic ossification, or if it connects the two, it's called a synostosis, which would obviously limit your rotation. So the ulna you can feel on your own arm. You can feel your ulna bone. If you look at your if you hold your arm up like you're in a karate chop somebody, and then just follow your pinky down, that bone you're feeling that goes all the way down to the tip of your elbow, that's the ulna. That's an easy approach. I mean, literally anybody listening to this podcast can do that approach. You just go right down to the bone.
Cut with a knife.
Obviously, when you're putting the screws and stuff, the ulnar neurovascular bundle is nearby and all that stuff. That's a different story. But and then the radius you can approach in various ways. Either by going on the front of the forearm or the palm side of the forearm, or you can go on the back of the forearm. There are different advantages of different approaches. I do a lot of nerve stuff, and so the fear people have with approaching the radius bone through the front is one of the nerves, the posterior interosseous nerve. As you get close to the elbow, can be problematic. It can be in the way. I go after that nerve for other reasons intentionally through a very similar approach. So that I will go all the way up on the volar approach, on the palm side approach.
Bold.
Without any reservation whatsoever. I think that the approach on the back of your arm is kind of limited, especially as you get further down the arm. And so I don't routinely use that.
So dorsal Thompson, volar Henry for the residents out there. But anyway, all right. So moving on to stuff that might be more appealing to the majority of the people out there. So he goes, he has surgery. Let's say it's a both bone forearm fracture. They put some plates on there, like you just described, and they're saying definitely back this season. Definitely back. Maybe the end of the season. He's on IR, so he's at least four games, which is actually 5 weeks because there's a bye week in there and they don't count that. So he's that. No, they don't count that. So I think it's week 15 against Seattle. I think is the first possible week back. I think that's how it works out. I forget exactly. But so at least four games, at least 5 weeks. But they're saying probably the end of the season, definitely the playoffs, assuming they make the playoffs. I don't know personally. Again, I don't do these fractures. Hand them to guys like you. But I was a little surprised by that. What are your thoughts on that possibility?
Yeah, it's only surprising again because of all the legal things that have come out against physicians within the past year that have resulted in enormous sums of money for
even for people trying to do the right thing.
And they're returning them too soon and all this kind of stuff. So, it's conceivable. I mean, it'll be healed by then, or what he'll be required to play in. But after surgery, I put people in a splint more so for swelling and comfort than for protecting it, like we might do for other things. So. For a lot of people, some people you could probably just let them leave with an ACE wrap on their hand from surgery, because it's a stable construct, and we let them start moving it early. But no matter what, the human body still has to heal bone, and we describe things that 6 weeks is some people have described as one orthopedic unit. Why 6 weeks for everything? Who knows? I'll see you in 6 weeks. Then we'll check this. 6 weeks. Therapy is 6 weeks.
Pretty standard.
In reality, we all heal things at different rates. I tell people 6 weeks minimum for bone healing. I don't have anyone try, and most people I take care of are trying to get out of going back to work for their whole rest of the whatever. So it's not quite the same debate, but what I'm returning people to at 6 weeks is nothing like that, which is I think the surprise is not you can use the arm or whatever. It's you can play NFL level football at 6 weeks or 5 weeks. Boy, I would be sweating bullets on the sideline if that was my patient plan.
Mm-hmm.
If it's single bone, does that make it a little bit like easier to get back or more likely to get back at that relatively early sounding period of time?
It is what easier to get back in that time?
If it was a single bone, if it's just the ulna or just the radius.
No, yeah, because again, we're not debating techniques or hardware or like, Aaron Rodgers got a speed bridge, so he's
right. Right.
It's just the amount of time for bone to heal.
It's biology.
End of story.
Right.
It's not like a better plate than the other one or a different surgical approach than what I described. Oh, he goes through a minimally invasive thing. Yeah. It's not about that. It's just physiologic bone healing.
Right.
Which is a little bit of where I get hung up when we're talking about fractures.
Right.
In your guys' world, I think there is a lot more debate. I know you have the same hard and fast principles, but you could conceivably see how somebody could recover from a rotator cuff, an ACL, whatever, because there are a lot of factors that go into that. True, there's like hard and fast healing, but soft tissue is like, I just feel like there's a lot more variation in that and rehab. And this isn't even about rehab. This is just like, are you healed or are you not healed?
Right.
I don't know. And who knows? Where this stuff goes from here, nobody knows. He's put on the thing. People have their reasons for doing stuff. We'll see.
I was surprised.
We'll see where he comes back.
I was very surprised.
Yeah, I'm just hearing that now. That's shocking. That's shocking to me in terms of return to full play.
Right.
I could even see practice.
Yeah.
Like Iverson practice. Talking about practice. Yeah, I'm talking about practice.
They're talking about
practice. I could see that, but I don't know. Full contact seems nerve-wracking with a bone that's possibly not not fully healed.
Yeah.
There's, it's the hardware is good, but man, another injury would be bad.
Really bad.
So it's kind of funny. So I did a quick search on my phone, and a similar injury to a same position tight end, very well-known Rob Gronkowski back almost a decade ago now.
Yeah.
Right.
So good.
So just to reference it, he fractured his forearm November 18th, which is, we're pretty close. We're only 10 days off from that.
How about
pretty much.
that?
November 18th, he had a forearm fracture, and then again, it was reported that he had a forearm fracture January 13th.
I remember that.
13th, so that's about 8 weeks after.
Yeah.
And I don't know the exact details right now. I'm not looking it all the way up. But it's going to sound like, I assume he was still in the Patriots at the time, making a playoff run.
I remember that. He was, yeah.
Broke his forearm in early November, tried to come back.
Yeah.
Had some issues and ended up kind of re-injuring it. So, I don't know.
Seems kind of bold.
To
try to do that.
And you have somebody, you can make your mild comparisons of Gronk and Dallas Goedert, is that they're just big physical tight ends, and they try to run people over after they get the football in their hands.
Both injured often.
Right. It'll be a tough kind of comeback. And luckily for the Eagles, at least, he's not their main go-to target. He's not Jalen Hurts' favorite person.
Yeah, but he is still.
He's still a very valuable piece, right? So it's just interesting how the time, I was kind of shocked that it was like early November kind of situation, very similar to what we're talking about tonight.
We tried this once before, and it didn't
work
work out so well that time.
We've seen it before.
Yeah. And it could be the same thing. These are all like these early things, and and we don't even know what we're talking about. It could be a totally different surgery, but my hang up is if there's any fracture at all, I don't see it. Maybe, but that's tough. Maybe a finger fracture, but not a forearm.
Right.
Yeah.
I don't know. I think they're going to be okay though.
I would hope so.
Fortunately, we have a lot of options. We've got we got good receivers and stuff like that, and so we lose the tight end, but I think it'll be okay. And they've started out. They're arguably the best team in the NFL right now.
Right.
So at least they got some wiggle room coming down the stretch here.
Yep.
They got a week off. look back at the playbook a little bit and that kind of stuff.
Sure.
Jalen Hurts honestly makes me more nervous.
Yeah, I would like to know more about that because I want that to be shown. I just don't know anything about it.
The bone bruise that will never go away.
Right.
Yeah, that dirty bone bruise.
Yeah, I mean, we'll see. I mean, man, every game he's limping around and all this stuff, and we can replace a tight end, but.
You can't replace a Jalen Hurts with a Marcus Mariota.
He's special, man. He is. He's special.
Yeah.
You can't argue that.
Things didn't go so good for him in Atlanta. So
right.
So
we'll see.
I'm gonna, as we wind down though, another question, right? So and my getting into a little bit of the detail in terms of the approach was a little bit of a setup, right? Like so what I was getting at is just sort of what we need to, and sort of getting into the detail on how we fix it, right? That it's a plate, so it's a big open surgery, big incision, moving muscles around, getting down to the bone, and putting plates on there and screws and plates, and as opposed to a rod or small incisions, was a little bit of the setup in terms of talking about like recovery time and getting back, and then the other big thing here then is function, right? Like so let's say miraculously, and I don't want to put it like that, but let's say the bone does heal, like they do X-rays 6 weeks from now, the bone looks great, there's large what we call fracture callus or healing bone, or the fracture site is completely hazed across, and it looks like it's pretty well healed and pretty strong, and they're going to get him back. What about the soft tissues at that point in time? Like all of the muscles that control your hand are really based in your forearm, and this guy has to catch balls that are being fired at him. Like is that a particular issue? Is he going to have stiffness? Is he going to have weakness? Is he going to just kind of be a little bit off? Is it more likely he's going to struggle to catch the ball? Would you foresee that as a potential issue, rushing back too soon?
Everyone heals differently, but I don't find that is a very big problem with people who are young and healthy.
Yeah.
That's like more of a concern for like the overweight or out of shape or elderly or what have you.
Yeah.
Just because they're at a disadvantage coming into surgery.
Mm-hmm.
We're like moving muscle around, and sometimes even kind of releasing muscle insertions and stuff like that.
Right.
Which sounds barbaric, and you think, boy, I mean, this guy's never going to recover.
Right.
Body's amazing.
People do really well, and it's getting a little into the woods on, when we use the plate as opposed to the rod.
Right.
Yeah, it's more invasive, but that's also giving us what we call absolute stability.
Yeah.
So that is rigid fixation across the fracture, and because of that, you can start moving right away. So like a lot of the stiffness, soreness, muscle issues, all that stuff, I mean, they recover pretty good.
Yeah.
And I mean, it's a factor. It'd be a big factor if he was Jalen Hurts and he had to throw the football.
Yeah, that's true.
I'm not so sure, catching it, he's going to be able to grip comes from so many muscles, you know what I mean? Like, there's just like backups on backups. I think that he's going to be okay in that regard. It's big incisions, but he's a healthy guy. It'll heal fine, and it'll be. I don't feel like that's as big a factor as just like the straight up bone healing time frame. And when the bone's not healed, it's going to be sore, and so I'm not sure he's going to be confident to go run across the field with his arms in the air while some linebackers coming at him 100 miles an hour the other direction. It's like
the body tries to tell you, man, you're not ready.
Best guy for the job, you know.
And just the ability to fall safely going forward, right? Like I think that's what happened in the Gronkowski case.
Was it going down?
I think he kind of just fell again in a bad situation, just going for it. And that's kind of the nature of football, right?
Yeah. We'll see you next year.
Yeah. So we'll see.
Yeah. But based on that,
I would think they would hold him, and the chance of them going to the playoffs is so high.
Right.
I'm not 100% sure I really get that drive to get him back in 5 weeks. That's I'm not sure I understand what we're accomplishing there.
And I don't know that they're going to get him back in 5 weeks, right? Like it's just with the IR. If you're on IR, it's at least 4 weeks, but because of the bye, it's at least 5 weeks. But the truth is, actually, I don't know that they're trying to get him back in 5 weeks, but they're saying pretty definitively by the end of the season and definitely for the playoffs. Is there a role, and this is maybe leading us into some future conversations that we may have here, but is there a role and is there an ability to 3D print a splint or something for him to wear upon return? Is there a splint or a support structure or something? Or at that point when he comes back, like if you're relying on that, then you've already lost the race. Like kind of a thing where the bone has to be strong enough, and you're just going back, and that stuff just going to limit you. What are your thoughts on that possibility?
Yeah, I mean, you can wear stuff. How much that helps, I'm not really sure. The MLB guys can wear stuff to like not get hit with a 100-mile-an-hour fastball in the elbow.
Right.
Yeah, I think Barry Bonds.
No one's running after Bryce Harper and tackling him to the ground, unexpectedly or anything. So
no one in Philly, I can tell you that.
Of course, they have braces, and they work with, hand therapists who every day. I mean, they come up with all kinds of things to return people back to stuff. The problem is what he's going back to. I'm not sure there's anything that's going to be super helpful for that, and also allow him to, perform. I mean, if you put him in a cast, what does that do for a tight end? If he's like
probably not. Doesn't help him.
A defensive lineman or something. It's one thing.
Yeah.
Right.
It's not. What we don't need. That's what I'm saying. That's like the whole point. Is like he's not Jalen Hurts out there. Like it's not like we can't move forward without him. So I'm not sure it's worth sticking a like from the movie Little Giants, like the kid with all the allergies, like wrap him in foam and put like 10 helmets on him. I don't really see the point of all that for getting him back a week or two early. Like I don't know that that's going to improve his performance or the outcome for us as a team.
Yeah.
I
think it's see what happens at this rate, right? Like kind of see what's going to happen. Again, we don't really know exactly which bone in his forearm was fractured, if it was 1, 2, or one or both.
Right.
What kind of surgical procedures they're going to go under, and
a lot of question marks.
The only benefit, to all this situation is that the fact that they have a bye week, so it kind of gives you an extra week with no games to
well-timed
add a little game planning and practice adjustments to get the backups kind of in line to see what's going on, and then I guess we're gonna have to wait and see, right?
For sure.
Yeah, plenty of time for Julio to take some reps at tight end.
That'd be great. I think all of Philadelphia would like to see Julio Jones play some tight end and get some more reps. I mean, it's a possibility, right? You never know.
That's bold.
Bold. That's definitely a bold prediction. I like it.
Right.
So I think
I'm going for it. That's my controversial call of the day.
There you go.
Right.
Julio for tight end.
Yeah, man. I just had my med school change paces just for a second. I just had my med school reunion.
There you go.
Last weekend. 20 years, man. 20 years since graduating, but it was great. It was back in Georgetown. So were a bunch of friends. It was really, really nice.
That's awesome.
All right. I don't know. Was there anything else you want to try to cover on the...
No, I think that's it, unless we start going down the weeds before a bunch of other forearm and other hand injuries with Dr. Jennings on the phone. But I think we covered our bases and touched on this forearm fracture. And I think we played out all the possibilities for the general listener, for the advanced listener, if you will.
All right, yeah.
So, Dr. Jennings, again, thank you so much for your time.
Yeah, really appreciate it, John. Thank you.
We're going to go ahead and close out our tab here and give a quick shout-out to our sponsors like we always do. The Energy Lab, the region's premier sports performance center and destination. Neck of the Woods Brewing Company brewing us up these beautiful beers and then and giving us these great milk tubes that we're going to end the show with.
Oh, every time.
And
it's so
lastly, Timber Road Productions helping us put this together. Now we already the audio format and the video format for those folks listening on YouTube. Thank you again, and everyone have a great day, evening, or morning, wherever you're listening to us, and we appreciate your support.